दर्द सहने की ताकत वेरी गुड. दर्द सहने की आदत मत बनाओ.
We are not born to suffer. Do not normalize pain.
Where has this come from, this decision to look into women's health?
If I can find a solution by myself because somebody else is not able to help, because somebody else is not vocal enough to talk about it, and because it is a taboo to even talk about it and think about it, then how do we do it?
What do you think is a systemic or cultural change that is really the need of the hour today, ma'am?
21st century people have to wake up and talk more about sustainable menstrual health rather than just menstrual health. We are seeing so many girls coming now with PCOS. Why is it so?
A lot of women just feel like now menopause has happened, our periods have stopped. Obviously, hormones have stopped accordingly. It's the end of life as we know it.
Menopause, if you just divide that, also means me no pause. Go out. You want to go with your girls to anywhere in the world? Go. You want to go with your husband? Go. Do whatever you want, not for the sake of society. Your body is a temple. Take care of it. If you don't take care of your body, then what is it you're going to take care of?
Welcome to the Shezzi M Show. This is a podcast that highlights the vagaries of 21st century living and how to hack it. And I am truly fortunate. Why? Because today I have the most special guest in my studio. She is a laparoscopic surgeon, she's an obstetrician, she's a gynecologist, but more than all of that, she's a system changer. This is somebody who, through her gynecological innovations, through her community support, has very actively contributed to bringing so many, and I could say thousands of women, stark focus about their health, about dignity, about the choices that are available to them. She's a Padmashree Awardee. She's a Guinness World Record holder. I think this entire podcast will get over. I'll keep introducing you.
Thank you, Shezzi. And I think we'll stop it at that and continue our conversation.
Dr. Manjula Anagani in the house. Ma'am, I just painted this beautiful picture. Where has this come from, this decision to look into women's health?
So I think it is there in every woman actually. When they start going through so many things in their life, then they think that if I'm going through, definitely there'll be many more who will be going through. So if I can find a solution by myself because somebody else is not able to help, because somebody else is not vocal enough to talk about it, and because it is a taboo to even talk about it and think about it, then how do we do it? So that is where, we see a lot of lacunae in the awareness among people, because it's always like, even if you ask a small kid, 6th class, 7th class, they think their friends know better.
Yeah.
They always discuss with their friends, not with the teacher, not with the mother. So when we know that we are going to ask somebody in our peers to ask that, even that person will only know as much as you know, but we'll not think of that in that age group. So that comes from, again, acknowledging that the awareness level in everybody is very, very low. That's because media was not talking, government was not talking, nobody was talking, and teachers do not know. Mothers also think that, in fact, mothers are the first people who would have told the kids in those generations that, why are you asking these questions? You're not supposed to even talk about it. When you become big, you will know. It is like, baby is born in the tree, ostrich will give the baby, and a thing. And people are inquisitive. Yeah. And everybody is inquisitive. That's how our brains are formed. So we are so inquisitive to know, we end up learning the things the wrong way.
Yes.
So it is better to give the right information to the right people at the right time. So when we think like that, I think automatically the choices will form and come. So I think I will definitely give a lot of this thing to media, not the social media now. That time, when it was very difficult to even approach, then it was only media would be reaching out to people. And they did run columns, and I used to run a column with a lot of question answers, then how to tell them that what is right, what is wrong, what are the options available. So I think I've been chosen one. I've been lucky.
That's amazing. I love the perspective that you bring, that I'm the chosen one. And you're saying that everybody is going through this period of lack, but there's not a lot of people who have the courage or the gumption to say, no, this is the need of the hour clearly. And I think also, along with all the amazing work that you're doing as a surgeon, Pratyusha has come about as well. Ma'am, can you tell us a little more about Pratyusha support?
See, it all started with the same thing, that until somebody goes through something, they don't know the value of your health. Unless you lose it or you go through some hurdles, and you will and after that again everybody forgets once you become healthy. So that's how it all started, when somebody was not well, and then they said, oh, we should do something similar to people and all. And with our experiences with movie field and all, we know that people tend to forget.
Yeah.
So that's how it all started, my relationship with Sam. And then we said, okay, let us do things together for a year. Then we will see if we have to start. But she sustained. She said, yeah, 1 year we did do a lot of work for hemophilia and all those things. And at the end of 1 year, we said, okay, if you are sustaining in spite of you becoming healthy, that you still want to do things for people, that's when we started. Then comes, how many people should we take and how should it go, what should we do? Because starting from two people who are too busy in their two different fields. She is a heroine who has very busy, no time for anything and lot of work, and me being in my field, hardly any time. And second, being woman, how much can we do? And being vocal and awareness is not the only thing, because our aim was three things. One is to spread awareness. Second is to do any preventive measures, what we can do, like giving proteins or giving vaccines, or even talking about the importance of supplements and giving supplements to the thing. And the third thing was to support the needy people who needed the particular surgery or anything, because that is the only field I know. So that is something which we had to do, and how to go about. That's when we thought that, yeah, we will take one manager, one more person, so 3-woman army, where our manager, she would be the person who will be looking at, really are they needy or really they are low. That is very important to do the background check. And then we started this place called Pratyusha Support, where we support the other NGOs who are doing their work when it comes to the preventive thing. So we support Valmiki Foundation, we support Spooty Foundation, but most importantly, Desire Foundation, which is for HIV-laden kids. Whereas Valmiki is about the orphanage.
Right.
And Happy Homes is again orphanage. Spooty is also orphanage, but again to empowering people. So 4, 5, and any other thing who will ask us for, depending on need base. Then when it comes to awareness, we do to all the schools, and then sensitize them regarding the bad touch, good touch, and what should be done, what's the vaccine, about health and everything, women, menstrual health and all. Then the third part comes, which is the most important thing which we do. We associate with the hospitals like CARE and Pediatric Hospital, both not Hyderabad, it's Andhra, Telangana and Chennai, with all the pediatric hospitals where, anybody who needs a particular surgery. And 1/3, once we do the background, and most of them are either cardiac or nephrology, urology. We talk to the doctors there, or even malignancy, ALL and all, their outcomes are good. Or even central, we have a blood clot in the brain, or any orthopedic surgeries. But hospital is one thing where we support the orthopedic surgeries, where 1/3 is for women and children. The patient has to pay 1/3, hospital will waive off 1/3, and we will give 1/3. Okay. So that way, patient will only have to pay 1/3 of the total bill. So anything which we are giving free is never appreciated, and that will not go a long way.
Yes, absolutely.
So they have to know the pain of getting the healing done. And 1/3 is something which people can afford, and they should be working towards the health. And this has been a successful program which we've been doing with so many hospitals. And any case like that comes, the doctors themselves approach us, and then we go through that, talk to the doctors, see the outcome, how it is, and go. So this has been like from 2012 we've started, almost 13 years.
Wow.
And continuously doing sustaining that very low profile. We just do our work and go ahead with that.
Beautiful, ma'am. So lovely. And a little while ago, you spoke about how topics of gynecology, women's health, menstrual health, reproduction, fertility, these are taboo topics.
Absolutely.
So many people don't want to come forward. What do you think is a systemic or cultural change that is really the need of the hour today, ma'am?
See, the thing is, unless you're a born rebel, you don't talk about it. That was the thing. It was always when we were kids. We were kids. Girls were supposed to get home by 4:35. You're not supposed to play outside. So that's why are boys given the choice to play outside? Why can't we play? That starts from the mindset of rebellion from the childhood when we start growing like a boy. So then comes all these menstrual products which is just coming up there, and when that comes, we are not supposed to look that side, this side, we are not supposed to look onto the television, then covering those things, and all his paper covering, going and getting, and we cannot go to the shop and ask. Our brothers only will go and get them. Medical shop, maybe we cannot ask for sanitary napkins. From those days to now, a huge this thing is changed. But now again, we understand that in the last 4 decades, what happened, how it destroyed the health. Because when we were only thinking of how safely we should take care of the menstrual period which is there and how we are going to dispose it, people never realized what was being given to us. We never knew the value or what was happening of organic versus the plastics. There was steel when we were eating, steel plates, steel this thing. Now everything is disposable. We want to eat on something and throw it away.
Yes.
So we are increasing the garbage. We are increasing everything which is not eco-friendly. Plastic plates, plastic spoons, plastic cups, everything. Then over time, in the last 1 decade, we understood what we are doing to the environment and the ecology in the thing. It takes almost 500 to 800 years for one sanitary napkin to be completely destroyed by it's a biodegrade होने के लिए. So when we are talking about it, now we know the last 2-3 decades we had very high incidence of certain diseases like PCOS, endometriosis, fibroids, ovarian cancers, hormonal imbalances, endometrial cancers, and rashes in that area. Then don't forget the thyroid and diabetes.
Oh dear. What? That's also linked, ma'am.
Everything is linked. Now, everything is linked to plastics. Everything is linked to the garbage which we are doing to the pollution in the environment. Now, when we are increasing the pollution, what's happening? What is happening is there is endocrine disrupting chemicals which are being produced. So all these dioxins, PSBs, they are all endocrine disrupting chemicals. So these endocrine disrupting chemicals destroy the endocrine system in the body. So hypothyroidism has increased, diabetes has increased, and Hyderabad is the diabetic capital in the whole world.
Oh dear.
Yeah. And then these things which we know are destroying, we are keeping them close to our organs, close to our genital organs, without knowing. Tampons and this thing, diapers, children diaper has again plastics. We are allowing them to be nearer to the genital organs, which has increased the infertility rates, which has increased all these diseases. Then now we realize that is it. Even now if we don't open and be vocal and talk, we are going to destroy the human being. Any planet we are destroyed. So we should at least try to strive and survive now. And so this time, I think in 21st century, people have to wake up and talk more about sustainable menstrual health rather than just menstrual health. So we have to talk about how we can be eco-friendly and friendly to ourselves, save ourselves. So it is all about no plastics over privates. That's why this particular project, NoPOP, is very close to me. I've been talking from 1 decade in our conferences. It doesn't make much of a difference. Then I realized it is no point talking to our doctors alone.
Yeah.
It has to be, most of the time when it's always a consumer. It's like, you ask, then only somebody will produce something and sell it.
Correct.
So it's all like, demand and supply. Yeah. We never say supply and demand. Demand and supply. So I've been trying to talk to the gynecologists and everything in conferences about it from last 1 decade and didn't much make a difference. Then I changed the whole scenario into let me talk to the consumer, then demand and supply. So that's when this NoPOP and everything we started talking about no plastics, use organic sanitary napkins, or you can use period panties, or you can use cloth, or you can use menstrual cups, and then tampons, which is organic. So there are so many alternatives. Use whatever you want, but see that you are safe, your children are safe, and you don't have rashes, you don't end up having all these endocrine disrupting chemicals in your body. So time to wake up and talk about it.
Lovely. Ma'am, you just spoke about, menstrual cups and all of that. A lot of us are actually using and have been using for some time, but a lot of mothers are also so hesitant about giving young girls menstrual cups. Oh my God, you will vaginally insert something. How does that even work? So would you like to share a little bit about that, ma'am?
So first thing is, from time immemorial, we've been incorporated about the so-called virginity and association with Hymen. I know. So it is, what we need to understand is Hymen is not a strict, rigid membrane. It's a very elastic membrane, which is very soft and pliable with micro pores in it, so that menstrual blood which comes out. So you put something, it bends like this. Okay?
Correct.
That is first thing people have to understand.
Yeah.
Second thing people have to understand is vagina is transverse and not vertical.
Yes.
So it doesn't fall down. Menstrual cup, when it is put, it is staying like this. It doesn't fall down. Now, the third thing is, everything comes in different sizes. You get a small size, you get a medium size, you get a large size, depending on you are still an unmarried girl or a virgin, or once you are in a sexual life versus once you have a child.
Yes.
Everything has differences depending on amount of blood, amount of bleeding, and the laxity of the vagina.
Correct.
Now, the second thing is, because people have told immaterially anything to talk about vagina, talk about everything is a taboo. We think that is something which is not right to even think about it.
Yes.
Inserting something is something. So when the sexual life starts and the whole life is about inserting something, why are we having so much of the taboo in our brain?
Thank you.
Understood? So when we talk about in pregnancy and hormonal support, also we put vaginal tablets. And when we are talking about infection in the vaginal tract, once the sexual life starts, we put vaginal tablets. And when we do a transvaginal scan, it is a probe which goes vaginally, which identifies any diseases of the uterus and the thing. So first thing is, instead of thinking that it's a taboo to talk, it is done day in, day out, but we just don't talk about it.
Correct.
So the whole shadi ke baad starts with everything inside the vagina. Then baby comes out through vagina. Then from where in the world it became a taboo, where in the world it has become unhealthy and unsanctified thing, organ.
Yeah.
It's your body. You should be comfortable with your body, comfortable using everything. And most important thing is, vagina is a self-cleansing organ. It is the most pure and most clean organ in the whole body.
Yeah. Self-cleaning,
Actually, so it is very, very, very healthy. So it's a very pliable. The menstrual cup is made up of a silicone, and it is inert. It does not cause any reaction, and it's once you buy it, it is for 12 years. It is for 12 years. For sometimes it is for lifelong. So you can just carry it in your bag, some corner. Just have to use it, wash it with soap, and then insert it. After 6 to 8 hours, remove, put it, empty your blood, and again wash it. You can use it for 12 hours if it is very scanty and you didn't have time to take it out. We just have to fold it into 4 times, just put it, and it just opens and it snaps back into the shape of the vagina. It takes its own shape. We don't have to be worried about it. So these are few things which mothers have to understand, that when a kid is playing, when a kid falls down or on the bicycling, also hymen can tear. Doesn't mean anything. And when the menstrual cup is put, the hymen just takes the shape and gets inside. So it does not break the hymen. Virginity is not lost with menstrual cup. This is safest and easiest way for the girl to carry without feeling shocked, because today's generation want to swim, want to dance, want to go around without having the stress of, is something seen behind? Is the bleeding coming out? Is there any leak? If you don't want to think about everything, you can use menstrual cup, period panty, or anything which helps you.
And in fact, we're in 2025. Can you please focus on safety of your child more than virginity?
Yes.
Like, please.
Most important is safety in the health-wise, that we do not end up with malignancies, because unfortunately in the last 4 decades, now the statistics say that 1 in 4 to 1 in 5 in India have cancers. So this is reality. That means that if we are 5 people sitting here, one of us is going to get a cancer in the near future.
That's something that
Scary.
we need to really think about. I'm also going to pause and let that sink in, because we are exactly 5 people over here.
Yeah, true.
No. But ma'am, a little while ago you spoke about the vagina being a self-cleaning organ. Can I say organ?
True. Yes, it's an organ.
So there is so much in terms of marketing as far as douches, perfumes, scents and all. All of them are endocrine disruptors, right?
They are all endocrine disruptors, and this bakwas. That is all how people want to make their own financial gains, because that's how anybody is. Anybody wants the finance. We all live for making a living. People have to make a living. And they definitely are going to make it on somebody who doesn't know the thing. See, the cost, we become what we eat. Everybody knows that.
Yes.
So when we are putting, whether it is cosmetics or anything, it is getting absorbed into the body. They're all endocrine disrupting chemicals. What we eat, where they're going to be ugalified, like where they're going to be produced, depending on the underwater, what does the minerals are there in the underground water there, that is going to come into the plants, and we are going to eat that. If we are going to eat raw, we are going to end up with problem.
That's also
that's again very contaminated. So we need to just cook it properly and then only eat. So these endocrine disrupting chemicals, which are on the face, gets absorbed also, we are worried. then why are we keeping again nearer to the genital tract and causing all this? Douches are never advisable at all for the thing. We want a particular pH in the vagina, that is acidity, so that you don't get infection there. So if vagina is an acidic organ, again, it is made acidic. Stomach is an acidic organ. It is always has acid in it. We don't want hyperacidity, but we want it when we eat something. The acid in the stomach is the one which is going to digest that.
Yeah.
That's very important. Same way, when there is any infection, it tries to go into vagina. The acid in the vagina, the pH, is the one which kills it. And you have Dodderline bacilli, which is a normal organism there, which keeps it acidic. So your good bacteria, the good bug and everything, because everything, we all talk about gut, anything what you eat is what you, same thing is there in the vagina also, which is very normal, good one. That does not allow the infection to come inside. And you are going to disrupt it. You are destroying it so that you end up with infections is definitely not advisable.
Absolutely. Ma'am, we spoke a lot about mothers explaining to their daughters about menstrual health. And I know that you've advocated a lot about menstrual knowledge.
Yes.
What is that one thing that every adolescent should know about menstruation? And do you think it's only girls or girls and boys alike should know?
Menstrual hygiene is something which is for everybody. There's no difference in the sex there with a girl or a boy. It is for everybody that at a particular age, there is a hormonal change which happens. If you have more testosterone, you are going to emit the testosterone through all your pores and your apocrine glands. So your sweat also can smell as a different thing depending on what how much hormones you are going to emit. So you need to take care of it. You have to use deodorant, but not again perfume. One, you might have to use and trimming of the hair wherever it is. So it's a choice again. Now people want to say, I want my hair and all. This is all rebellion what you have. We are not talking about whether you want to live with hair or no. But here we are talking about hygiene. Keep it clean. That is what is important. So in the menstruation time especially, we are looking at how frequent, 6 to 8 hours, whether you're going to keep it clean, change your sanitary napkins every 6 to 8 hours. See that you don't leave it there, that the rash comes. And also that when the urinary infections also we want to prevent for a woman because of this. We always tell women that you need to drink lots of water, never hold urine for a long duration. And whenever you pass urine, pass forcefully. And after intercourse, get up and pass urine. These are few things which every woman have to do when it comes to this. And the trimming and keeping yourself clean is something we don't have to do. But I think one thing people have to know is making these conversations a front room conversation.
Absolutely.
People can talk. Yeah, you can always ask there's something which is you're not comfortable with. Talk to somebody who they can tell. Their experience can help you. It's something, now on the social media and everywhere you have a lot of forums. When it comes to any disease, you name it, you have that, mom's group, that group, this group. So we should always put it there, and you can get a lot of wrong things also from there. So final decision, if you have any doubt, I always tell people, you make your gynecologist your friend and then ask them. Get the right information. Again, don't just go and Google and start knowing everything which is there and get more confused about things.
Lovely. So hydration, menstrual hygiene, and using sustainable products which are not plastic in the area of your genitals. This is my 3 takeaways. Thank you.
Absolutely.
So lovely. Ma'am, a little while ago you spoke about PCOS, and I was just imagining, because I know a lot of people who are struggling with this, and unfortunately we're at a time where we are information dense.
Yes.
Every third person on the internet is some random reel, one influencer
Everybody will
making. Yeah. So, there's diet, I have to watch out for nutrition, exercise, this, that, blah. I suppose, assuming that I'm a young girl, let's just assume.
We are all young. Okay. We are all young. I tell the people, this is something. Whom all I have delivered way back in 94, 95, 96. They all come. They are almost 30 years and all. They say, we want to take a photograph with you. And I said, you all have become adults. I didn't. I'm just the same. Now, don't try to make me old because you have become adults. So that is something we are all eternally younger.
Yes, I totally agree. So I'm just imagining that I am a young girl and I'm struggling with PCOS and I have 50 things people are bombarding me with. Ma'am, what would you say to somebody, like, where can I start to kind of figure out what's happening with me and what is the right direction for?
See, first thing is, yes, PCOS is increased again, like I said, because of these napkins and see, PCOS is increased because almost like 1 in 4 or 1 in 5 again, even though they say 1 in 4 in the textbooks because it is underreported. I feel it is 1 in 3. It's like we are seeing so many girls coming now with PCOS. Why is it so? Because of our Indian culture of putting stress on the kids when they are in 7th, 8th, 9th class, of putting a stress of education, stress of that and everything. So when adrenarchy happens, that is where adrenal glands, that is a fight or flight response, and the steroids and everything goes. That's where we are putting a lot of stress to study. So that will not say, "Maya akeli kyun tak hu," I will affect the other organs. So that starts affecting the next thing, that is what we call it as the ovaries. So with that going haywire, your thilarchy, pubarchy and menarche will start. That's the way it goes. And when this menarche happens, this goes awry. So what exactly is happening in PCOS? Symptoms and then what things. So we look at three things. One, symptoms. What is the patient going to have? Second, picture scan. What is the scan going to tell us? Third, biochemical analysis when we do what is. There's so many tests, we found so many abnormalities in this. But most importantly, finally we understood there are three things happening. One is hormonal imbalance. Second is insulin resistance. Third is hyperandrogenism. We'll go into one in one. When there is a hormonal imbalance happening, your periods become irregular because you are not having one good follicle which is developing. So no egg, no children. So no egg, delayed irregular periods. So you might get periods once in 4 months. You might get periods only when you take medicines. You might it might be difficult for you to conceive because there's good egg which is not developing. And so many things. You might have PMS, you might have bleeding continuously without stopping till you take medicine. Anything can happen. The second thing what happens is insulin resistance. Here the symptom would be, I'm putting on weight, I'm not able to lose in spite of me not eating much and in spite of me doing the regular exercise. Yes, that is what happens because there is insulin resistance where the receptor becomes so tough that whatever you eat, normally body will produce insulin which is going to digest that sugars. Here there is a resistance, so insulin is being produced but it is not able to be effective. So it's an ineffective insulin. So we need to give insulin sensitizers or decrease the load on these receptors. Both things have to be done. So we'll come to that again. There are lean PCOS where people will be thin, but they also have insulin resistance.
Wow.
So the third thing which is happening is the hyperandrogenism. Locally, what your girls are supposed to have is estrogen, progesterone. They will have increased testosterone out there. Because there is increased testosterone, they'll have acne, they'll have hair loss, abnormal hair growth on the chin, bodies, on the lips and everything. Just hands, everywhere. And these are three things with which anything can happen. Does it mean that everybody should have these three? Not necessary. So when we look at these three, we are tell people 2 out of 3. Either symptom plus a biochemical symptom or a scan. And there is another set of people who come to us. Everything is fine. They go for scan. Scan will show PCOS, so they come running. That is nothing to be worried about. Only one thing we are not. Like I said, 2 out of 3 should be there for us to label them as PCOS and start treatment. But saying that, what is very important to prevent, because there is no age group. It can come at 40, it can come at 50, it can come at 15, 14, anything. Because whenever stress is there, it can precipitate. So whenever they come to us, we tell them about 3 things very importantly. One, we tell them you need to do regular exercises. Okay? And when we say exercises, that's when the problem comes. We do yoga every day. We walk for so many kilometers. They are not going to help for PCOS. They're good. They're good for stretching. They're good for breathing exercises, everything. But they're not good for PCOS because we are looking at insulin resistance. So every muscle has to contract. So we look at exercises like cycling, skipping, swimming, aerobics, gymming, that sort of a thing. The second thing we tell them is change your diet. Like I said, the insulin load, the no need for that insulin should come down. The load on the receptors have to come down.
Correct.
So decrease your carbohydrates and increase your protein. I would not suggest a cow and all that, but in your plate, see that carbohydrates are less, protein are more. That's it. The third thing which we spoke about is stress. So de-stress yourself. So when we say de-stress yourself, anything which helps you. It can be songs, it can be dance, it can be gossiping, anything, whatever. But do that. Nobody should tell you what will de-stress. You think what makes you happy and de-stress yourself. There's no one particular technique. It can be meditation, it can be something else. If you are taking meditation and your thoughts are going somewhere, that's not the thing, right? So think about something else, whichever is going to help you. These are 3 essential things for us. The fourth thing which I always tell patients, people, is that the addiction. That goes a long way. smoking, alcohol, drugs, everything which is rampantly increasing. You need to understand that your body is a temple. Take care of it. If you don't take care of your body, then what is it you're going to take care of? Environment को कैसा देखोगे when you cannot take care of your body itself.
Yeah.
So these are 4 things. Then comes our intervention. So we get a scan done, we get blood tests done, which we talk about insulin resistance called HOMA-IR. We also get a test called testosterone for the increased androgen. We also get a test called FSH-LH on second day of period. Okay, symptoms तो patient के साथ आएंगे. So test so we do these things. So scan shows, we'll keep it aside. Then these reports में जो abnormality है उसके हिसाब से we start the treatment. So what do we do? If the central hormone are imbalanced and periods are irregular, we start the tablets which will make them regular. If insulin resistance is there, we give insulin sensitizers which are also taken by diabetics. It doesn't mean you are diabetic, but if you're not treated, you're going to become diabetic.
Right.
You are pre-diabetic.
Okay.
Okay. And the third thing, if testosterone is high, we give an anti-testosterone or something to decrease the testosterone. Whatever abnormal hair and acne which have already come, we tell you to go to a cosmetologist, dermatologist to get them treated. But jo next aane ka hai, usko we start treating.
Okay.
So we do this, and then when do we analyze? We tell them to do all these exercises, take medicine. Every 6 months we retest them, and accordingly we take the medicines off. Does it take a long time to become normal? Yes, PCOS is a lifestyle disorder. So we never tell them there is cure. We only tell them that this is something which has to be under control. Why is it needed that we have to keep it under control? Because if untreated, this can lead to metabolic syndrome called hypertension, diabetes, heart disease, lipids being more, heart attacks when I say heart disease, and also many types of cancers. So if we don't take care of it, apart from the infertility and all which are simple, you can end up with major diseases like heart disease and cancers, along with hypertension, diabetes and hyperlipidemia. So if you don't want them to happen, you should just follow your lifestyle for lifelong. But medicines can go off depending on how effective you are. Every 6 months we reassess and then take off. But if you are having a stress at any time, we tell them to continue the medicines till you think of pregnancy, because depending on the need of the day at a different phase of your life, we treat them. People who want to become pregnant, we induce them for pregnancy.
Okay.
People who don't want to become pregnant, we give tablets to control the disease.
Okay. Ma'am, I'm just, while you were saying all of this, I'm just thinking how PG-13 I am. You said de-addiction and I first thought, yeah, phone addiction. No.
Yeah, all those also very important.
That
Phone
also
addiction. Means you're getting stressed, seeing everything on the phone. You're so much preoccupied with that you're not allowing the flight of ideas into everything which makes you happy.
Absolutely.
आज phone paper खोलो, कुछ भी खोलो, only thing you're seeing is murders, killing,
Or deaths, right.
everything.
Yeah.
Why do you need to stress yourself with all the see everything which makes you happy? That's I believe in comedy films, comedy things, everything.
Lovely. Yeah, that's actually a great de-stressor also. Absolutely. Ma'am, you spoke also a lot about endometriosis and fibroids. And you know, the thing is, the other day I was having a chat with a friend, and the statement she made was, it's so normal now. Is it normal? Should it be normal?
That is the point. In the last 4 decades, we had made the system like that, and we are normalizing thing which is not normal. We are not born to suffer. That's the first statement. So when we are not born to suffer, who made us suffer? Mankind. With all these things. So is there something we can change? Yes, we are trying to. But what can we do with who already got it? Then we have to treat it.
Yes.
So do not normalize pain. There are lots of treatments which are there. Go meet your doctor. Talk about endometriosis. Be vocal. Keep it under control. Like PCOS, endometriosis also is a disease where we do not talk about cure. We only talk about how to keep it under control. Endometriosis is a locally destructive disease which is like cancer but not cancer. We never talk about cure. Like a chemotherapy, like a surgery followed by chemotherapy, we always give medical management, surgery followed by medical management, or medical management followed by surgery depending on the need of the patient. So always understand what it is, don't be in denial, and then talk to your doctor and take your options and then treat yourself accordingly.
Lovely. You know how we always say कि ओ लड़की जात हूँ, मेरे को दर्द सहने की ताकत है. दर्द सहने की ताकत, very good. दर्द सहने की आदत मत बनाओ.
Absolutely.
That's literally it. Yeah.
And don't normalize things. There are so many things which people normalize. Pain in the period.
Yes.
And blood. I always bleed more. Clots are normal, no? And whenever we cough and all, urine comes out. That is also normal after a particular age, no? Everything. Hot flushes, normal, no? You get angry before period, normal, no?
Yeah. Not normal. So
Nothing is normal.
Nothing is normal.
It is okay to accept and do it, but it's not okay to suffer.
Ma'am, in fact, you spoke about, urine coming out and all of that. Not enough is spoken about pelvic floor rehabilitation. Can we talk a little about
Absolutely. See, whatever we see, people are very interested to go to gym and get the body shaping, body contouring and everything.
Yeah.
People don't understand the pelvic floor is the main thing which is allowing all the organs in the abdomen to make them straight and stand there.
Yeah.
So pelvic floor supports the bladder. Pelvic floor supports the uterus. Pelvic floor supports the rectum and the anal canal.
Yes.
If that goes and it just stays and that you're not redoing it with the proper exercises, the organ starts prolapsing.
Yeah.
So with it happens this thing of not able to control the motion, not able to control the urine, everything. Why do we have to do? Is there a solution? Yes, physiotherapy, simple physiotherapy, Kegels exercises just after delivery. You go to gym and start working on biceps. Please work on your pelvic floor. That gives the dignity which you deserve. So I tell the patients only one thing. See, you go to parties, you want to show off your jewelry and everything, but you go there and you're getting embarrassed, but you don't want to go to the party because of that. Or you want to wear a diaper and go because you don't want to be embarrassed. Yeah. That's not the way of the thing. Because there is solution. Don't normalize it. You have pelvic floor therapy, and then we have Amsela chairs and pelvic floor therapy chairs, which gives this contractions of 11,000 contractions over 28 minutes. 11,000 in 28 minutes. Weekly twice for 3 weeks, and your pelvic floor is set. Then maintenance is once in a year. So why are we doing so much for the face and not for the thing?
Yeah.
So that is what is important. Then you have vulvovaginal rejuvenations, which we do depending on the need for the things. So I think people have to understand that a solution is there for everything. That happens only when you know there's a problem. Instead of normalizing it, go and discuss with your gynecologist. They will give you the options.
Lovely, lovely. And, I think, ma'am, so when we were talking about urinary incontinence a little while ago, so symptoms could be literally after a baby, I've sneezed suddenly, I've coughed suddenly, and I've passed off a little bit of urine, right?
And after menopause, it worsens because your estrogen is gone. So muscles become more weak. Right. Collagen is destroyed. So it becomes more worse. That's when old people will start living in diapers. Yeah. The highest expense in the Western world now is because of the diapers in the old age, because our life expectancy has increased.
Yeah.
Then people came up with, all these multi-billion-dollar diaper companies and all these things are surviving all over the world because we are living long and not ready to rehabilitate ourselves.
Yeah. Okay, that's interesting. And ma'am, so you think that whether it's a vaginal birth or a C-section birth, everybody should have pelvic floor?
I say that because in vaginal birth, it is more because baby comes out through that, so it distends itself, and there's also some amount of muscle damage which is going to happen. But in pregnancy itself, because of the hormones, all the ligaments and collagen, pelvis starts getting ready, so it relaxes. We need to understand that. Okay, so that relaxation after the delivery, whether it is cesarean or vaginal, if you don't do pelvic floor exercises, it's never going to go back to normal. Same thing about spine. You have a waddling gait in pregnancy. Your spine starts, because the pregnancy is going to pull it from the forward, and the ligaments have started relaxing because of the progesterone. Your spine starts going like this. If you don't do your exercises after delivery or after cesarean after 6 weeks, till that time having a abdominal corset, your spine doesn't come back to normal. So you will have a permanent backache because your weight falls from the head to the spine and through the pelvic bone to the legs to the ground. Your gravity is going to pull your weight. And if the spine is like that and your weight is going to fall here and here, the pain is going to be there. And the permanent backache is not because of spinal injection. It is because you have not done your spinal exercises.
That is a brilliant revelation, ma'am. Any woman watching this, any man watching this who has family who are going to have babies and everything, pelvic floor rehabilitation and posture clinics for your spine. Vital, please. Ma'am, what a brilliant thing, because everybody says, oh, no, I took an epidural.
So I have a pain.
Now I have a pain.
Absolutely, this the myth that is.
That's an eye-opener even for me, to be honest. Thank you, ma'am, for sharing that. Ma'am, you spoke a little bit about menopause a little while ago, about
Right.
how that incontinence can increase. Um, in that same vein, a lot of women just feel like now menopause has happened, our periods have stopped. Obviously, hormones have stopped accordingly. It's the end of life as we know it. What are your thoughts about that?
So my simple funda is menopause. If you just divide that, also means me no pause.
Wow.
So I think this is the time we need to understand that 1/3 of your life actually living in that is more than 1/3 if your life expectancy more. First 15, 16 years, you're a child.
Yeah.
From 15 years to 45 years is the time 30 years.
Yeah.
Then 15 for 45 to if you're living 75, 30 years.
Yeah.
Means almost half of your life when you start knowing what it is, you are living in that. And that is the time your children has gone and they start living and you are going to have your life with your husband or your whatever. So what happens is that you are actually having a me time there. And this is the time you're going to face each other. And that is the time you should go for a second honeymoon. Start actually thinking about how to make yourself look, feel beautiful, do everything for yourself. Because till that time, you are only thinking about your children, how to make them study, go and all. Now they left. So it is the empty nest syndrome. And you start going, your hormones are gone. And then you can also have depression suddenly because nobody is there and all that. Yeah. So start rejuvenating yourself. Yeah. Think about that. So this is the time for no pause. So me no pause, and then for that what has to be done? You need to rehabilitate your pelvic floor. See what all you want to, how you want to be in your life. What do you want to do? Start doing those things. Make a new hobby. Both couple therapies, couple destinations, couple hobbies. Do everything what you want to do. Make your life most memorable one in the last 1/3, because all your responsibilities are over. Now the responsibility is towards yourself. So you're getting hot flushes, there is treatment. Come back and talk to us. We will see that they go off. And if you're having dryness, sexual life issues, then we are here to help you. You can have a vaginal rejuvenation. Your libido is less. We have Z spot, O spot, PRP therapies. We can talk about it and do that. And if you feel that what is there, I want to go into a spiritual thing, that's again your choice. We are not here to do anything. But think what you want. Don't do it because somebody is telling you. Do what you want to do. At this age, again, we need to understand we are aging, definitely. So our bones are very important. Our brain is important. Our heart is important. So take care. Be in the care of your gynecologist. See that your bones are healthy. Take the necessary calciums, vitamin D, if necessary, monoclonal antibodies to keep your bones well, and check your breasts, see that if there is any nodule, and also check for your lipid profiles, hypertension, diabetes, and all those things, routine things which can come, and see that your lipid profiles are not so high that your heart also gives way, and your memory. That's the most essential thing. If you don't make new hobbies and think about living yourself, you're going to go into Alzheimer's because estrogen is less. So whether you want or not, we are going to live 30 years minimum. I'm only taking 75, yeah? There are people who live to 100 also.
Yes.
90 also.
That's the plan.
And make it the most thing. So urinary issues. So we always talk it as vaginal dryness, urinary issues, psychosomatic things like, depression and all that. And then autonomic, like, hot flushes and all that. All these things have to be taken care of. And long-term complications like, osteoporosis and the heart thing and the cancers and the brain also should be taken care of. These are things which we will help. Rest of the things like rejuvenating yourself, face-wise, pelvic floor-wise, and getting the thought processes that we are here to have life. Make your own girl grind, which will help that. Go out. You want to go with your girls to anywhere in the world, go. You want to go with your husband, go. Do whatever you want, not for the sake of society.
Beautiful. I love this me no pause. It's a brilliant thing. Just allow yourself to be happy. This is the one life. 2/3 of it you have taken off because mummy ka suno, daddy ka suno, pati ka
First
suno.
15 years
Bachcho ka
is only mummy ka suno, papa ka suno.
Yeah.
After marriage, it is always responsibilities also. Whether sune nahi sune, you are born to have responsibilities towards your household and the children. But after that is the me time. Yes. So no pause time.
Beautiful. Ma'am, thank you so much for sharing. That's so lovely. I have a very cool segment that I want to do, and it's called What Would Manjula Ma'am Say?
Yes. Okay. I thought only See only, no? Bak to kar rahi hu tab se.
Ma'am, it's valuable information. This is gold. This is pure gold. I hope people start like saving bits and pieces that are relevant to them. In fact, if you have any questions or any doubts or any way you want to ask Manjula ma'am questions directly, we're going to share her Insta handles and all the other, if that's okay, ma'am.
Yeah,
I did
understand
ask.
is what I would prefer.
So we'll share that, and please feel free to reach out to her. You can write to us also, and we kind of transfer those questions if required. But what would Manjula ma'am say? I'm going to give you a few scenarios, ma'am, and I want to see what you would say to the P. Okay, so there's a young girl. She's just maybe a couple of years into her periods. Okay, now she's getting heavy flow, massive cramping, too much pain. She has started to miss school.
Yeah.
What would you say to her caregivers?
See, I would say first take her to the gynecologist. That is the first thing. She has to, see, girls usually confide to their mothers, but sometimes they do not, to the friends only. But I want the girls to make the gynecologist their best friend, where they can confide everything. And then we would look into, first 2 years, usually there will be little irregularity. For that, we don't start hormones immediately. But the pain, again, do not make pain a thing, because endometriosis, like we spoke, starts even in adolescent age group. Sometimes it can be a congenital anomaly of the uterus, which can be the reason why she's having pain. So gynecologists should see and should know the reason and treat accordingly.
Okay. So befriend your gynac, basically. Okay. And now, ma'am, gynacs are not like the old judgy. Kya kar rahi hai?
Absolutely. No. There is no role of judging anybody. I believe that kutta ka kaam kutta karna hai. Or gada ka kaam gada karna hai. So I always tell, I'm not a priest sitting here. I'm a doctor. I'm here to treat. I will treat.
Lovely.
That's it.
And I think it's safe to say that that whole landscape has changed.
Yes.
You don't have a very stern lady saying at you. So please actually genuinely befriend your gynecologist. It's a good thing to do.
Right.
Okay, ma'am, scenario number 2. Newly married couple, and now the husband is turning around and telling the wife, fertility and all that is your responsibility. What would you say to the man?
See, definitely there is another scenario also, which in the same group, which I see is, no, I'm having a girl child first time. The next time, if it's not going to be a boy, then you'll go and sit in your mother's house. First thing men have to understand is, if you take WHO, not me, okay, WHO, 1/3 is the girl, 1/3 is the boy, 1/3 is both of them are reason. So if you put it like that, 50-50 is a thing. So you need a sperm and an egg. It is not 2 eggs which is going to make a baby. So it can be a fault of a sperm. It can be a fault of an egg. In fact, there are so many things which can go wrong in anybody. So it is, both of them should be evaluated. Both of them should be tested. Both of them should go to the doctor. And if it is a girl or a boy, it's totally the sperm job. Nothing to do with eggs.
Correct? Established? Okay. Lovely. No, so yeah, and when it comes to fertility also, it's
50-50.
It's a 50-50 thing. Please wake up and smell the coffee. Okay?
Yeah.
This whole, tumhara zimmedari hai, it does not hold good. Ma'am, now, this is not a gynecology related question, but I do want to know, okay? Young couple newly married. Before the last fera is over, one relative has said, when is the baby due? Now this girl is not ready.
Naturally.
She's like, it's probably an arranged marriage. She doesn't even know who she is.
You want to understand also.
Yeah. What are your thoughts?
See, depending on age of the patient, I would say, if she's married young, they have enough time to understand each other and then go think of a baby. If she's married late or she's not yet married, thinking of like marriage, I would definitely advise the girls to go for a oocyte freezing and then have a child whenever they want. The baby should be loved. Baby should be a wanted baby. It cannot be an unwanted child of a marriage. Even if it is very early, even if the marriage is going to sustain, it should be at a time when they want the baby. That should be a love child.
Yes.
So, if the mother was getting married at 32, 33, I usually tell the patients, please freeze your oocytes, then get married, no issue. Whenever you want to have a child at 38, 40, you can have a child. That's fine. But we do not want the egg to lose its quality and do not want a aging sperm or aging egg.
Correct.
So that we end up having abortions or we end up having an abnormal child.
Correct.
That's what it is.
Fair enough. So you said oocytes, eggs, no ma'am? Eggs.
Eggs. Right.
Okay, great. Ma'am, so this is for all those people who want to have a child, but they want to delay it. So you're giving them an option. Great.
Who don't want and they're young, that is something they need to wait and understand what's happening. If they're old, I still tell them to speak, because we are, as a human being, are very fickle-minded. We change our mind.
Yeah.
At 30, I might not want. At 40, suddenly, I lost it. I should have thought of it and all. So then it is always better to have a backup, plan B. So freeze it. You don't want, don't use it. There is nothing wrong except financial thing in freezing them.
Correct. Fair enough. Ma'am, but you know how society at large, and I want to say in our country in particular, our whole, if you're a woman, womanhood is equal to motherhood, otherwise it's not womanhood.
Very funny. I saw a movie in Telugu which was there. It is like, even the kids are brought up like, you're born, you're 25%. You attain menarche, you're 50%. You're married, you have 75%. And if you have a child, you're 100% woman. Otherwise, you're not a woman. I mean, what nonsense are we talking about?
And this is what they're peddling in movies nowadays.
This is from a movie only. So I am like, what? Dash, whatever it is. Okay. So
Ma'am, it's okay. You talk.
what are we talking nonsense? You're a human being. You're born. Your identity is a woman because you're born as a woman. Phenotypically, you're a woman. But what you want to do in your life, it's totally your way of looking at life and thinking about it.
Yes.
So this is, nothing makes you a whole. You are the person who is going to make yourself a whole. Beautiful. That's it.
That's just exact. Are you listening? Okay. Ma'am, let's just jump straight into a segment that I want to call Fast, Furious and Feminine.
Okay.
So I'm going to share questions, and however short you can kind of share.
It has to be.
Yeah, it's almost like a rapid
It's like
fire.
rapid fire, and you're going to put a gun onto my head. Okay.
No.
Okay.
Ma'am, one word that you would like for women to associate with their own bodies.
I think, I really think we are beautiful by birth. So beauty inside out.
Beautiful. Okay. One moment of unparalleled pride that you felt in the course of your career.
Recently, I think whenever we give birth, do lives. That is what is thing. Especially when somebody who was 9th time pregnant with 8 pregnancies lost, and then we could sustain it and give it baby, and they are super happy then.
8 abortions.
8 abortions.
Ma'am, that's really God's work that you're doing, no?
We go personalized care, so we could do it. Like I always say, we are chosen people, so we should.
So lovely, truly, so lovely. Ma'am, one medical myth that you really wish, can you please die now?
Medical myth. There are so many, I really don't know. One thing I would say about menstrual hygiene only, it's the abnormal blood or dirty blood which is going out.
Oh, God.
So if it doesn't go out, we are keeping all the toxins inside.
Ma'am, this is a whole podcast episode already, so on one day. Okay, ma'am, one chapter in your medical science textbooks that you would wish that you could rewrite?
The whole concept of the way we should only be doing trial vaginal deliveries and destructive obstetrics to give birth. I feel this is the era where we should not talk about destructive delivery. By hook or crook, we should deliver vaginally. That should not be there. The concept should be that healthy mother, healthy baby.
Beautiful. Yes,
I feel
that narrative has to be healthy mother,
healthy baby, rather than somehow or the other baby has to come out vaginally only should be changed.
One personal mantra that you really believe in?
I believe that be yourself and believe in yourself. Lovely. That's my motto.
Ma'am, I just want to ask.
You don't have to ape anybody to be successful.
Yes, that's a nice one. Okay. Ma'am, there are a lot of young girls who are automatically conditioned to either hate their bodies or say, oh my God, period aa gaya. Oh my God, this, oh my God, that. They're very hesitant about themselves.
Yeah.
So my question is, what would you say to them as a woman of power, to somebody who's going to be a woman of power soon?
See, the point is that we need to understand 5 fingers are different even in your own body. But all 5 fingers are beautiful. Yes. So what we need to understand, the whole purpose, the thing that we are born itself means God thought there is some reason why we are born.
Yes.
So body dysmorphism, we are seeing too much because we are comparing to others. Stop comparing. You are beautiful the way you are. That is what you need to believe. Like I said, be yourself, believe in yourself.
Wonderful, wonderful. Manjula ma'am, to wrap up this entire beautiful, amazing episode that we have just had, since this is a podcast that highlights the vagaries of 21st century living, is there one 21st century hack that you would like to share with us?
I think the time management is something which we which I think everybody is trying to do, and then they are doing it wonderfully. And I believe in that. Discipline is something which it is not just 25, because olden days we all used to be, laid back. Hoga, chalega, hoega, we can do it at our own pace.
Yeah.
But now we are pace.
Yes.
Everybody is in there and they are doing it. So it's one life. Whatever we want to do, we can do. And we can balance our life by doing our hobbies plus this and all. So I believe that time management, discipline is something, is the 21st century.
Manjula ma'am, you are fabulous as usual, and I'm so grateful that you gave us time today. Thank you so much, ma'am.
Thank you, Shezzi, for having me on your show. It's always a privilege and happy.
Thank you, ma'am. If you enjoyed our episode today, please don't forget to share your thoughts, your views, your comments. And like I said, we are still in touch even after this podcast. If you have questions, drop them in the comments, or we'll share Manjula ma'am's handle and mine too. And we will see you in the next one.